Day 11 of Colorectal Cancer Awareness Month. Now that we understand the importance of colorectal cancer screening, let's talk about 3 questions you should ask prior to getting a colonoscopy. First of all, what are the prep choices? So a prep is the medication that you drink the day before to clean out your entire colon. While there are several choices, there are a few that I prefer, and actually one that I prefer the most. The first one is the OG Go Lightly. It comes in a gallon clear plastic jug. It has the powder in it. You mix it with water and you drink it over about 4 hours. The upside to this one is pretty much everyone gets very clear with Go Lightly. The downside is it is a lot of volume. It's 128 ounces and it tastes a little bit salty, so most people by the end are pretty nauseated. There are other options like Movi Prep and Soup Prep. They're about half of the volume. They also have that kind of salty taste, and they require you to drink more water afterwards to get clear. Those are pretty well tolerated. There's another option that requires you to take tablets. So that one is called Sutab, and there are a couple other varieties, but essentially you take 1 tablet every 15 minutes with 8 ounces of water. You kind of get the same results. My favorite one is the Miralax Prep. You essentially take 2 medications. Both of them are over the counter. One is a pill and one is a powder, Miralax, which is tasteless. And you put it in 64 ounces of Gatorade. You drink that over about 2 to 3 hours with other clear liquids. So not only is it half the volume of the Go Lightly, it doesn't really taste that bad, and patients get pretty good results. Another question you can ask is, what are my sedation options? Most people, when they get a colonoscopy, get some sedation. That could be in the form of going all the way to sleep, not requiring a breathing tube down, but you're pretty much out, and that usually uses propofol. There's another version where you get a couple of different IV medications that make you a little bit sleepy, but you are not all the way out. That one is called conscious sedation. And then, believe it or not, I've had a couple of patients that want no sedation at all. They are completely wide awake. They don't even have an IV in their hands. And the right patient can tolerate that pretty well. Take note that anytime you have a colonoscopy, if you get any kind of sedation, whether it is the propofol total IV anesthesia or the moderate sedation, you will need somebody to drive you home. Okay, what is the recovery like? Honestly, if all goes well, you won't even notice that you had a colonoscopy by the next day. You may have some runny stools afterwards. Your first couple of meals may go through you pretty quickly, but other than that, most people are completely asymptomatic.